to our professor, Ma'am Nerissa Beatriz, to my classmates, good morning. My report is about ADHD. What is ADHD? ADHD is Attention Deficit Hyperactivity Disorder. This is also referred to as Attention Deficit Disorder. One of the most common neurobehavioral disorders of childhood, usually diagnosed in childhood and often lasts into adulthood. The average onset is 7 years old. ADHD has 3 subtypes. First is the predominantly hyperactive impulsive. Most symptoms is 6 or more are in the hyperactivity impulsivity categories. Fewer than 6 symptoms of inattention are present, although inattention may still be present to some degree. The second subtype is predominantly inattentive. The majority of symptoms, 6 or more, are in the attention category, and fewer than 6 symptoms of hyperactivity impulsivity are present, although hyperactivity impulsivity may still be present to some degree. Children with this subtype are less likely to act out or have difficulties dealing along with other children. The third subtype is combined hyperactive, impulsive, and inattentive. 6 or more symptoms of inattention and 6 or more symptoms of hyperactivity, impulsivity are present. Here, most children have the combined type of ADHD. We come now to the symptoms of inattention. The child is easily distracted, miss details, forget things, madaling makalimutan ng bata ang isang bagay, frequently switch from one activity to another, difficulty focusing on one thing, becomes bored easily, difficult to focus attention on organizing and completing a task or learning something new, trouble completing or turning in homework assignments, often loses things needed to complete tasks or activities, doesn't seem to listen when spoken to. The child experiences daydreams, and the child becomes easily confused and moves slowly. Here the child fidgets and screams in their seats, talks non-stop, dashes around, touching or playing with anything and everything in sight. So yung bata, ikot ng ikot kung ano yung makita, hahawakan at saka paglalaruan. Trouble sitting still during dinner, school, and story time. And the child is always constantly in motion. The child is very impatient, blurts out inappropriate comments, show emotions without restraint, acts without regard for consequences. We have here myths about ADHD children. Sabi nila, all kids with ADHD are hyperactive. Magalaw yung bata. Kids with ADHD can never pay attention. Kids with ADHD could have better if they wanted to. Kids will eventually grow out of ADHD. Medication is the best treatment option for ADHD. So what's the causes of ADHD? Scientists are not sure what causes of ADHD. It may be due to genes. Learning about specific genes could help researchers lead to better treatment. Environmental factors. Studies suggest a potential link between cigarette smoking and alcohol use during pregnancy and ADHD in children. It may be due to brain injury. Another cause is sugar. The idea that refined sugar causes ADHD or makes symptoms worse is popular, but more research discounts this therapy can support it. Another is food additives. Recent British research indicates a possible link between consumption of certain food additives, like artificial colors or preservatives, and an increase in activity. Who are at risk? Sino yung mga bata na pwedeng magkaroon ng ADHD? ADHD affects 4.1% of American adult age, 18 years and older in a given year. The disorder affects 9.0% of American children ages 13 to 18 years. Boys are 4 times at risk than girls. This is because the guidelines used in assessment and diagnosis have traditionally focused on males. Undiagnosed women learn to recognize their ADHD after a child has been diagnosed and the woman begins to see similar behavior in herself. Treatment options. We have the medication. Most common medication is called a stimulant. Ito po yung medication na pwedeng ma-reduce lang yung sobrang galaw ng bata. Various types of psychotherapy, education or training, or a combination of treatments. Treatments can relieve many of the disorder's symptoms, but there is no cure. Researchers are developing more effective treatment and intervention and using new tools. There are no one-size-fits-all approach. Sometimes several different medications or dosages must be tried before finding one that works for a particular child. Some medications come in short-acting, long-acting, or extended-release varieties. In each, the active ingredients is the same, but it is released differently in the body. There are many medications that can be used for ADHD. One of the example of this is the Ritalin. So these are the child in the classroom. Ito po yung makikita natin kung paano yung bata sa loob ng isang classroom na may ADHD. They demand attention by taking out or turn or moving around in the room. They have trouble following instructions, especially when they're presented in a list. They often forget to write down homework assignments, to do them, or bring completed work to school. They often lack fine motor control, which make note-taking difficult and handwriting a trial to read. The child often have trouble with operations that require ordered steps such as long division or solving equations. So we have here teachers' expectations. First, sit the child where distractions are minimized. So, sa loob ng classroom, kailangan pong paupuin natin ang bata sa kung saan yung distraction ay mababawasan. Walang makaka-trigger na distractions. Structure the student's environment to accommodate his or her needs. Sit the child away from potentially distracting areas such as doors, windows, and computers. Child should sit at the front of the class where it is easier to pay attention. Use a signal to help the child stay on task. Find ways to praise the child. Center constructive criticism between compliments. Find opportunities to allow hyperactive children to use their energy. Have the child look directly at your eyes when speaking to them. When giving directions, keep them short and simple. Create a system to make it easy for parents and students to get homework assignments. So the teacher must find a student that can work as a homework buddy. And the teacher must reduce homework assignments. So if the teacher have this kind of pupil with ADHD, the teacher must be more patient in dealing with this kind of children. This is my report. Thank you for listening. Have a good day.